Hello everyone, welcome back to Pharmacy India. As you all know, Tamil Nadu government has released 425 vacancies for the post of pharmacist under the Medical Services Recruitment Board. And for that, Pharmacy India has taken an initiative in which we are providing you the classes daily 7 p.m. in the evening. Every day we are giving you classes regarding how to prepare for the pharmacist exam, and today is your class 7 in which we are going to discuss the questions related to the Drugs and Cosmetic Act. Today I'll be delivering 30 questions to you related to the Drugs and Cosmetic Act, and now let's start the topic. First of all, if you are new on our channel, then subscribe the channel for the better preparation of your Tamil Nadu Pharmacist exam, and for the latest updates you may please download the Pharmacy India mobile app from the Google Play Store, and also you may visit our official website, that is pharmacyindia.co.in on Google, and from there you will get latest updates and you will be getting quizzes, daily job updates, previous year papers, current affairs, subjective blocks, college details, A to Z complete information regarding these on our official website. And for daily updates you may follow us from various platforms like Telegram channel and WhatsApp channel. The links are given in your description box. From there you may follow us. Now let's start the questions. First question is, Schedule F2 under the Drugs and Cosmetics rules relates to. Now, according to the Drugs and Cosmetic Act, what is Schedule 2? And the options are surgical dressings, or that deals with standards for vaccines, or good manufacturing practices for Ayurvedic drugs, or standards for antibiotics. And the right answer is surgical dressings, because the Schedule F2 deals with the standards for the surgical dressings. That is why the option number A is correct. Next question is, which section of the Drugs and Cosmetic Act provides the appointment of inspectors? Now the question is saying, under which section drug inspectors are appointed? And the options are option number A, section 19, 20, 21 or 23. And the correct answer is option number C, that is section number 21. If we talk about section number 21 of the Drugs and Cosmetic Act, this empowers the central government to appoint these drug inspectors according to the provisions of this act, that is Drugs and Cosmetic Act. Next question is, Schedule X drugs require which of the following prevent misuse? Now the question is saying, what is a Schedule X? Schedule X drugs require which kind of a prevention for the misuse? That the options are option number A, prescription register to be maintained, or over-the-counter sales permitted, or a red box warning on both the label, or no specific requirement. And the correct answer is a prescription register to be maintained. Schedule X drugs are, as you all know, Schedule X drugs contain narcotic drugs and psychotropic substances for which pharmacists required to maintain a prescription register with the detailed information about the prescriber as well as the patient. That the prescriber, that is a doctor or a physician, and the patient is, you all know, who needs or who wants these drugs to get a proper treatment. And if the misuse of this drug is committed, then the patient or that individual person may be addicted towards that drugs, and maybe the condition would be severe. Next question is, which schedule specifies the requirements for the manufacturing of cosmetics? Now, according to which schedule, according to the Drugs and Cosmetic Act, which schedule deals with the manufacturing of cosmetics? Schedule M, M2, Schedule Q, or the Schedule T? And the correct answer is option number B, that is Schedule M2. Because if we talk about Schedule M, it deals with the good manufacturing practices of the drugs, and if we talk about the good manufacturing practices of the cosmetics, that is totally depends on the Schedule M2, because it outlines the good manufacturing practices for the requirements or the basic needs of the manufacturing of cosmetics to ensure their safety and as well as the quality. Next question is, what is the minimum imprisonment for repeated offenses involving spurious drugs under the Drugs and Cosmetic Act. According to the Drugs and Cosmetic Act, what would be the minimum imprisonment if someone is repeating offenses again and again, which involves the spurious drugs? And the options are 3 years, 7 years, 10 years or the life imprisonment. And the correct answer is option number D, that is life imprisonment. If someone is committing offenses again and again and that is involved in the spurious drugs according to the Drugs and Cosmetic Act, then the section 30 prescribes the imprisonment for the repeated offenses up to the life imprisonment. Now the question is, which schedule contains the list of biological and other special products whose import, sale and manufacturing are governed by special provisions? According to the Drugs and Cosmetic Act, which schedule deals with the list of biological and other special products whose import, sale and manufacturing are governed by special provisions according to the Drugs and Cosmetic Act? Options are A, Schedule A, or Schedule C, or Schedule F, or Schedule G, and the correct answer is option number B, that is Schedule C. And I'll tell you one trick for the Schedule C by which you may remember it easily. Then the trick is Sita, which contains S is for Sera, I is for insulin, T is for toxoids, and A is for antigens or analgens, because these are the special products or the biological products. Now next question is, which schedule deals with the requirement for the functioning of blood banks and the preparation of blood components? According to the Drugs and Cosmetic Act, which schedule deals with the proper functioning or the running of the blood banks and the preparation of blood components? And the options are Schedule F, H, J or C1, and the correct answer is option number A, that is Schedule F. You may remember one trick, that is F for fruits, and if we are eating fruits, then the blood flow will rise in our body, that is, and blood is maintained in, and the blood is kept in blood banks. For that, you may follow this trick to remember Schedule F properly. Schedule F defines the regulations for the blood banks or the proper functioning of the blood banks and the preparation of the blood components. Schedule H is for, it contains the list of prescriptive drugs, and Schedule J contains the diseases for which drugs cannot claim to cure, and the Schedule C1 contains the other special products but not blood bank components or the blood bank regulations. Next question is, which schedule contains the list of prescription drugs? According to the Drugs and Cosmetic Act, which schedule contains the list of prescriptive drugs? Schedule G, H, FF or the F1, and the correct answer is Schedule H. And if we are talking about the other options, Schedule G includes drugs that requires the supervision but is not specifically for prescription drugs. And if we talk about the Schedule H, it contains the list of prescriptive drugs that doctor's prescription is required, is must for dispensing the medications. Schedule FF deals with the ophthalmic preparations that meant for eye formulations or the eye treatment, and the Schedule F1 deals with the bacterial and the viral vaccines production. Next question is, which schedule sets the standards for the ophthalmic preparation? If you remember the previous question, then you would be able to answer this question. Which schedule, according to the Drugs and Cosmetic Act, which schedule deals with the ophthalmic preparation? Schedule FF or C, F3 or B1, and the correct answer is Schedule FF. Schedule FF deals with the ophthalmic preparations, that is eye gels, eye ointments or eye drops. And if we talk about the Schedule C, that deals with the biological and the other special products. And if we talk about F3, F3 sets the standards for the sterilized umbilical tapes. And if we talk about Schedule B1, Schedule B1 is for the pharmacopoeia laboratory test fees. If we are going to, and if we want our sample of drug or cosmetic, and if we want to get proper report or analysis of that particular sample, then we need to pay the prescribed fees. in the pharmacopoeial laboratory. Schedule B is for central drug laboratory or the state drug laboratory. And if we talk about Indian pharmacopoeial laboratory, then it comes under the schedule B1 if we want our sample to be analysis or to be tested. Next question is schedule J contains information about which of the following. Now according to this question, please find out the correct answer. And the option A is list of prescriptive drugs, standards for surgical dressings, or diseases that drugs may not claim to cure, or rates of fees for drug testing. According to this question, the correct answer is option number C, that is diseases that drugs may not claim to cure. If we talk about option number A, list of prescriptive drugs comes under schedule H, and if we talk about standards for surgical dressings, that comes under schedule F2. And if we talk about rates of fees for drug testing, that comes under schedule B or B1, but depends on the different laboratories. Now come to the next question. Which schedule specifies standards for surgical dressings? For surgical dressings, which schedule deals that? Schedule F2 or schedule G or schedule A or schedule E1? And the correct answer is schedule F2. Schedule F2 deals with the standards of surgical dressings. If we talk about schedule G, that deals with the drugs requiring the supervision of the medical supervision of the specialized doctors or the physicians. And if we talk about schedule A, the A deals with the application, that is a performer of the application if we want license, if we want to issue license, or if we want to get a renewal of our license. Now come to the next question. The next question is which of the following schedules deals with the list of poisonous substances under Ayurveda and Unani medicines? If we talk about the drugs under the Ayurveda and the Unani medicines, then which schedule deals with the list of poisonous substances? Schedule F1, E1, FF or G? And the correct answer is schedule E1, that is option number B. You may remember this schedule, that is E1, by a trick, that is any eats poison. From that trick you would be easily remembering the schedule E1. And if we talk about schedule F1, that is related to bacterial and viral vaccine productions. And if we talk about schedule FF, that deals with the ophthalmic preparations or the ophthalmic drugs. And if we talk about schedule G, that includes the drugs requiring the medical supervision. Next question is which schedule governs the import, sale and distribution of other special products? Now the question is saying which schedule governs the import, sale and distribution of other special products? Schedule C or D or C1, or last option is schedule H? And the correct answer is option number C, that is schedule C1, because schedule C covers the biological and other special products, that is Sita Mata, that is sera, insulin, toxoids and antigens. And if we talk about schedule D, that contains the list of drugs that is exempted from the import provisions. C1 governs the import, sale, distribution and manufacturing of other special products. And if we talk about schedule H, it contains the list of prescriptive drugs. Now the next question is what is the purpose of the Drugs Technical Advisory Board under the Drugs and Cosmetic Act? Now what is the main purpose or what is the main functioning of the Drug Technical Advisory Board under the Drugs and Cosmetic Act? And the option number A is saying conducting clinical trials for new drugs, or advising on technical matters related to drugs and cosmetics, or approving pricing for scheduled drugs, or issuing license for the manufacturing of drugs. And the correct answer is DTAB, that is Drug Technical Advisory Board, is a statutory body, comes under the central government or the state government, and this board, that is Drug Technical Advisory Board, is advising on technical matters related to the Drugs and Cosmetic Act to the state government and as well as the central government. The next question is how many total members are there in Drugs Technical Advisory Board? DTAB contains how many of total members in it? And the options are 10, 15, 18 or 20. And the correct answer is option number C, that is 18, because in DTAB, there are total 5 members are elected members and the 5 members are nominated members, and rest 8 members are ex officio members. And if we talk about the 10, the total number of DTAB member is more than 10. That is why the option number C is correct. Next question is, how many DTAB members are nominated by central government? Central government nominated how many members in DTAB? 3, 4, 5 or 6, and the correct answer is option number C, that is 5, because DTAB contains 5 members each in nominated and elected category and 8 members in ex officio category. Now the next question is, how many ex officio members are there in DTAB? That is Drug Technical Advisory Board. Options are 6, 7, 8 or 10, and the correct answer is option number C, that is 8, because Drug Technical Advisory Board contains only 8 members as ex officio members in it. Now the next question is, who is the chairman of the Drugs Technical Advisory Board? Who is the chairman of the DTAB? Options are Drug Controller of India, or Drug Director General of Health Services, or President Medical Council of India, or Director Central Drug Laboratory Kolkata. And the correct answer is Director General of Health Services. He is the chairman of the Drug Technical Advisory Board. Although Drug Controller General of India is a part of ex officio member in Drug Technical Advisory Board, and the President Medical Council of India is also the part of the Drug Technical Advisory Board as an ex officio member, but not the chairman of this board. Which of the following institutions is not represented in the ex officio members of DTAB? What kind of institutions are not represented in the ex officio members of Drug Technical Advisory Board? And the options are Central Drug Laboratory Kolkata, Central Research Institute Kasauli, or Indian Veterinary Research Institute Izatnagar, or All India Institute of Medical Sciences, that is AIIMS. And the correct answer is option number D, that is AIIMS. All India Institute of Medical Sciences are not represented as the ex officio members of the Drug Technical Advisory Board. Rest all 3 options are correct according to the Drug Technical Advisory Board category of ex officio members. Now the next question is, how many total elected members are there in Pharmacy Council of India? Total number of elected members in Pharmacy Council of India are 6, 8, 9 or 10, and the correct answer is option number B, that is 8, because PCI, Pharmacy Council of India, included 9 members as nominated members, 8 members as elected members and 3 members as ex officio members. Next question is, how many nominated members are there in PCI? You know the answer very well, and the options are 6, 8, 9 or 10, and the correct answer is option number C, that is 9, because PCI includes 9, 8, 3, that is 9 members are in nominated members, 8 members are elected, and the 3 rest are ex officio members. Now, who elects 6 members including at least 4 teachers in PCI? Medical Council of India, Pharmacy Council of India, UGC, that is University Grants Commission, or All India Council for Technical Education, that is AICTE. And the correct answer is University Grant Commission elects these 6 members, in which at least 4 members are the teachers in that particular cell. Now the next question is, how many ex officio members are there in PCI? You know the answer very well. These options are just restless, and the options are 2, 3, 4 or 5, and the correct answer is option number B, that is 3, because PCI includes 9 members as nominated members, 8 members as elected members and 3 members as ex officio categories members. That is why the option number B is correct. Now the next question, which of the following is not an ex officio member of Pharmacy Council of India? Director General of Health Services, Director of Central Drug Laboratory, President of Pharmacy Council of India, or the Drug Controller of India? And the correct answer is President of Pharmacy Council of India, because if we talk about the PCI ex officio categories members, then President of Pharmacy Council of India is not included in ex officio category. Now, the next question is, which of the following institutes is located in Lucknow? Which of the particular institution is located in Lucknow? Central Drug Research Institute, National Institute of Virology, Central Research Institute, or National Institute of Immunology? And the correct answer is Central Drug Research Institute, that is CDRI. Central Drug Research Institute is located in Lucknow and is a premier research institution for the drug discovery as well as for the drug development. And if we talk about the National Institute of Virology, it is located in Pune. Central Research Institute is located in Kasauli, and the National Institute of Immunology is located in Delhi. Now come to the next question. The question is saying the Factory Act was enacted in 1948 but came into force on which date? Although the act was passed in already in 1948, but it actually come into force on what date? 1st April 1945, 15th August 1948, 1st January 1950, or 5th June 1948. And the correct answer is option number A, that is 1st April 1949. What? 1949, 1st April. On 1st April 1949, Factory Act came into force to ensure the proper working condition in the factories. Now the next question is, Drugs and Magic Remedies Act was enacted in which year? Drugs and Magic Remedies Act was enacted in which year? 1950, 52, 54, or 56? And the correct answer is option number C, that is 1954. Drugs and Magic Remedies Act, that is an Objectionable Advertisement Act, was enacted in 1954 but came into force on 1st April 1955. It was created to prevent the misleading advertisements related to the drugs. Now the next question is, the Prevention of Food Adulteration Act was passed in which year? Prevention of Food Adulteration Act was passed in which year? 1950, 52, 54, or 56? And the correct answer is 1954. Because the Prevention of Food Adulteration was passed in 1954 and implemented in 1955 to control the food adulteration and to ensure the food safety and as well as the quality of the food products. The Medicinal and Toilet Preparation Act was enforced on which date? 1st April 1955, 1st April 1956, 1st April 1957, 1st April 1958. And the correct answer is 1st April 1957. Now come to the next question, that is the last question. Where is the Central Drug Laboratory located? Where is the CDL located? Mumbai, Kolkata, Delhi, or the Pune? And the correct answer is option number B, that is Kolkata. That is Kolkata. The Central Drug Laboratory is located in Kolkata and serves as the national testing laboratory of our country. And if you talk about Delhi, several medical institutes are in Delhi but not Central Drug Laboratory. That are the 30 questions from the jurisprudence, pharmaceutical jurisprudence, and the chapter name was Drugs and Cosmetic Act. These are the questions which are very helpful for your preparation of the Tamil Nadu Medical Services Recruitment Board pharmacist vacancies. For the latest updates, please download the Pharmacist India mobile app from the Google Play Store, and you may also visit our official website for the latest updates, quizzes, daily job updates, previous year papers, current affairs, subjective blogs, or the college details. You may visit our official website on Google, and for the daily updates, you may follow us from the various platforms, that is WhatsApp and Telegrams. The links are given in your description box. From there, you may follow us from there. And for the more efficient preparation of your Tamil Nadu Pharmacist exam, I recommend you one book, that is MRB Tamil Nadu Objective Book, that is a pharmacist success kit, in which you will be getting 5,000 plus MCQs, 25 model papers, 4 Tamil language eligibility papers, 4 previous year papers, and 17 online test papers as per the exam pattern. And you may order it from the Flipkart on cash on delivery. Cash on delivery is also available, and this book is also available on our Pharmacy India mobile app. The link is given in your description. From there you may order it And I'll also recommend you MRB Tamil Nadu Pharmacist Success Kit theory book, in which all the subjects of the pharmacist are covered in this book, and it is also available on Flipkart with cash on delivery option. The link is given in your description box. From there you may order it, and as well as you may order the Mission Pharmacist book. Link is given in your description because it contains previous 30 years question papers for your more efficient preparation. This book would be very helpful. It is also available with the cash on delivery option on Flipkart. Book's link is given in your description box. From there you may order it. We'll see you in next lecture. Till then, Jai Hind.